I'm here today to ask you to strongly support Senate Bill 1124 and House Bill 1914. When I first came to testify for this bill, I was 10 years out of a serious injury that left me out of work for 2.5 years. I've been back 15 years. Now it's almost 25 years. And I think it's absolutely absurd that we haven't gotten much farther than we have. We have equipment to utilize and assist us to prevent patient injuries, to prevent healthcare workers' injuries. We have equipment for every single movement we need to make. Myself, at the end, I've been almost 20 years as an intensive care unit nurse. Loved my job, loved taking care of critically ill patients and their families. Had a heavy assignment one weekend, assisted a patient back to bed, and that was the end of that. I endured many tests, many visits under workers' comp. They send you wherever they tell you to go, you go. I had surgery. Eventually, it became obvious that if all this was done to return to work, but it becomes obvious that to be pain-free, you're not going to be able to take care of patients. You need to be in control of your environment. I was very active. I played competitive racquetball. I jogged, many things that I can no longer do. And now it's still 25 years later, and I'm still asking for this legislation. It's very simple fix. Some of the equipment, the vertical portable lift, which I demonstrated at a hearing a number of years ago, is about $3,500. The cost of my illness to my hospital was $225,000. Why this regulation is needed is, take, for example, my hospital's 220 acute care beds. It's divided into 3 if you think about it. We have a new tower with safe patient handling equipment, the ceiling lifts. Slings are never available. Nothing's easily accessible. We have a new intensive care unit. Everything is accessible, ceiling lifts. We have another area of about 60 beds that has absolutely no equipment whatsoever. We purchased 5 portable lifting equipments about 10-15 years ago. They are nowhere to be found. Nobody knows what to do with them, and certainly there's no plan to purchase them more. I ask you, I beg you to stop making nurses patients and help the patients themselves. Thank you.